Hello, everyone. So today I'm going to do another review video. I wanted to share with everybody. This one is nursing review education for the cardiovascular system. So education post myocardial infarction. This is the education you provide to clients or patients after a myocardial infarction or MI. You want them to go on a low sodium and a restricted fluid diet. So they need 2 grams or less of sodium and 2 liters or less of fluid. Educate the client to take their pulse daily, weights, and report to the healthcare provider of any rapid weight gain, edema, or worsening dyspnea, which is difficulty or labored breathing. Patients who have just had an MI need to avoid foods high in sodium, which is like convenient foods like canned ham, canned meats, processed meats, bologna, ham, turkey, processed stuff, frozen meals. Those are usually high in sodium. Teach the importance of reduced stress. Teach them that they need to avoid alcohol. They need to avoid caffeine and foods with animal fats, such as beef, pork, lamb, veal, butter, and lard. They should increase their exercise to 30 minutes 5 days a week and quit smoking. Smoking increases the demand for O2 on the heart as well as causes atrial vasoconstriction. So the pathophysiology of an MI is fatty deposits or plaque develop on the arteries, causing them to be narrow. The heart requires oxygen to live, just like any other part of our body. So without oxygen, when the coronary arteries get clogged by plaque, the oxygen cannot travel to the heart. So the heart is blocked, and if the heart's blocked for more than 45 minutes, it can start to become necrotic. So MIs, myocardial infarctions, are more common in African American men, more common after the age of 50, more common in men than women. And without O2 or oxygen, the heart cells die and release a protein called troponin. Now, if you are watch Simply Nursing with Nurse Mike, he tells you troponin is very, very important on your NCLEX, and that there's a lot of questions about troponin on your NCLEX. So I do recommend you study troponin levels and more about troponin. So a review question. You're educating a patient about the causes of a myocardial infarction. Which statement by the patient indicates they misunderstood your teaching and requires you to re-educate them? So look for key words here in this question. Which statement made by the patient indicates they misunderstood your teaching? So misunderstood your teaching. Misunderstood is your key word here. So A, coronary artery dissection can happen spontaneously and occurs more in women. The most common cause of myocardial infarction is a coronary spasm from illicit drug use or hypertension. Patients who have coronary artery disease are at high risk for developing a myocardial infarction. Or D, both A and B are correct. So the answer for this is B. The most common cause of myocardial infarction is a coronary spasm from illicit drug use or hypertension. If your client says this back to you, they misunderstood your teaching, and that would be the answer. Okay, so Question number 2. A doctor has ordered cardiac enzymes on a patient being admitted with chest pain. You know that blank levels elevate 2 to 4 hours after injury to the heart and is the most regarded marker by providers. A. Myoglobin, B. CKMB, C. CK, or D. Troponin. And the answer here is troponin. Troponin levels are what we really monitor with a myocardial infarction. Let's move on to congestive heart failure. Congestive heart failure, or CHF, develops when there are changes to the structure of the heart muscle and the heart muscles cannot pump blood efficiently, causing the blood to back up and fluid to pool or build up in the lungs, the arms, and the legs. So right-sided congestive heart failure, CHF, is known as peripheral edema. This is less severe than left-sided congestive heart failure. So with right-sided congestive heart failure, we're going to see things like fluid in the lungs, JVD, which is big neck veins, abdominal growth known as ascites. The patient needs to report weight gain of 3 pounds in a day or 5 pounds in a week to the healthcare provider. Words like sudden, new, rapid, worsening, these indicate a priority patient. So remember that when you're taking your tests to look for those kind of words, and then you understand that those are the priority patients. What is going to kill our patients the quickest? Left-sided congestive heart failure is known as pulmonary edema. So think L, left, lungs, L, lungs. This affects the client's ABCs, the airway, breathing, and circulation. You're going to hear crackles in the lungs. You'll see pink frothy sputum, dyspnea, which is difficulty breathing, and orthopnea, which is shortness of breath while lying flat. So treatments of congestive heart failures give medications ending in IDE, furosemide, and bumutidine. Raise the head of the bed to semi-Fowler's or high Fowler's position. This is 45 degrees or 90 degrees. Give O2 via a simple mask. We're going to push furosemide, and we're also going to push morphine because this decreases the workload on the heart. Also, we would restrict sodium and place the client on fluid restriction and make sure that all IV fluids are stopped. So, review question. A patient admitted with heart failure appears very anxious and complains of shortness of breath. Which nursing action would be appropriate to alleviate the patient's anxiety? Select all that apply. I know we love select all that apply questions. A. Administer ordered morphine sulfate. B. Position the patient in semi-Fowler's position. C. Position the patient on left side with head of bed flat. D. Instruct the patient on the use of relaxation techniques. And E. Use a calm, reassuring approach while talking to a patient. The answers are A, B, D, and E. A. Administer ordered morphine sulfate. Now, we talked about why you give morphine. Let's see, where was that? It decreases the workload on the heart. B, position the patient in semi-Fowler's position. We went over that. You position them either in semi-Fowler's or high Fowler's. C, we're not going to position the patient in the left side with the head of the bed flat. That's a Sims position. That's not for congestive heart failure. D, instruct the patient on the use of relaxation techniques. We are going to do that. Let's go to the next page. So the patient position to improve ventilation, it will reduce. Okay, yeah, semi-Fowler's position will also reduce anxiety, and relaxation techniques will help calm and reassure the patient. And E, use calm, reassuring approach while we're talking to the patients. We don't want to appear worried or anxious because that's just going to make our patients worried and more anxious. I hope that this video has helped you and that you find my other videos helpful while you're studying for your HESIs or your NCLEX. I am just a nursing student. I'm not an instructor. I just make these PowerPoints and these videos presentations because it also helps me in my studying. So thank you and have a good day.